Hello everyone, and welcome back to Intuitive Epidemiology. In today's video, we are going to answer the question, what is epidemiology? My name is Taylor McClendon, and I am indeed an epidemiologist, and I do HIV research in Vancouver, British Columbia. As discussed in the channel introduction video, the word epidemiology can be broken down to its Greek origins, where epi means on or upon, demos means people, and logos means the study of. Therefore, epidemiology is the study of what affects populations of people. The goal of this channel is to help us develop our intuitions or our gut feelings with respect to epidemiology and epidemiologic research. The formal definition of epidemiology is as follows. It is the study of the distribution and determinants of health-related states or events in specified populations. And it is the application of this study to the control of health problems. Now, epidemiology is not to be confused with dermatology, which is the clinical care of the epidermis or the skin. Therefore, it is best that you address the following question, can you look at my rash, to a dermatologist as opposed to an epidemiologist. Now let's break down the textbook definition of epidemiology. We have the following words which appear: distribution, determinants, states or events, and specified populations. The distribution is referring to the occurrence of an outcome, a condition, or a disease. For example, how many people are living with a given disease, such as disease A? With respect to determinants, this could be referring to exposures, correlates, risk factors or protective factors, or causes of given outcomes. For example, what is driving new cases of disease A? With respect to states or events, these are outcomes or consequences of disease or conditions. For example, what impact does disease A have on one's health? And all of this is examined with respect to specific populations or study samples. For example, studies among people living with or at risk for disease A in Canada. To simplify the idea of epidemiology, we can think of it as a counting and comparing exercise. Specifically, among a group of people, we want to understand how many people are sick or how many people are living with a given condition or disease. We often want to know what caused this condition or this outcome, and how does this outcome or disease go on to affect one's health. To reiterate, epidemiology is focused on distributions, determinants, states or events, and specified populations, and we can visualize epidemiology with something known as a 2x2 table. I've given an example of a 2x2 table on this slide, where we have a state or an outcome, such as disease A versus not having disease A, along with a determinant. Either you are exposed to that cause or that determinant, or you are unexposed. In this 2x2 table example, I show that the population of Canada is approximately 37 million people, and that is our hypothetical study sample. And I indicate that 25 million people were indeed exposed in this case, where 20 of those 25 experienced the disease and 5 did not. Out of the 12 million people who were, quote, unexposed, 2 experienced the disease, and 10 did not. Now, I want to emphasize that epidemiology is indeed focused on specific populations. Therefore, epidemiology is often referred to as population health research. So while a medical doctor is largely concerned with the patient in front of them, an epidemiologist is concerned with the health of populations of individuals. Furthermore, to increase the feasibility and to understand where and how study results can be generalized, specific populations are ultimately examined. For example, studying disease A, whether that be HIV, cardiovascular disease, depression, or COVID-19 as examples, among a sample of people in Canada. Moving on to the second part of the definition of epidemiology, we are referring to the application of this study to the control of health problems. More specifically, the control of health problems is referred to as public health. Public health, as discussed on Wikipedia, is the science and art of preventing disease. More specifically, is focused on prolonging life and improving quality of life through organized efforts and informed choices. So what is epidemiology? It is the science behind public health practice. And an epidemiologist, like myself, is someone who understands how to generate valid evidence to organize efforts and inform choices. And in the context of public health practice, these choices and decisions often relate to the control of health problems. To push this further, public health organizations require valid and relevant evidence to decide where, when, and how to act. In terms of the epidemiologist, they have to ask themselves the following questions before engaging in evidence generation. What is the problem, or what is the health problem of interest that we wish to better understand? How do we collect information related to this problem? And how much information or how much data do we need to generate precise evidence? A major focus of epidemiology is also how we analyze our data in a way that is valid or unbiased. We then must also consider what we must do and how we must frame our conclusions and our recommendations. And we must ask ourselves, how do we share and present our evidence and get it into the hands of the right people, whether that be doctors, policymakers, or public health practitioners. So in conclusion, epidemiology is the study of what affects populations of people. We are focused on distributions of outcomes, determinants, and we look at this within study samples in populations of people. Epidemiology is a counting and comparing exercise, and the 2x2 table is often at the core of what we do. And lastly, epidemiology is the science behind public health practice. And with that, I would like to thank you for listening to this video and to ask you to please subscribe to this channel if you want to see additional content of this nature. Thank you.